Neighborhood Health Watch is sponsored by the doctors of HCA Virginia Health System.
When we talk about pregnancy, we usually talk about the 3 trimesters, but there's actually what's called a 4th trimester. It is the critical time after the baby is born, yet it's rarely discussed. The maternal mortality rate in the U.S. is actually rising, particularly affecting African American women who are 4 times more likely to die from complications related to pregnancy. It's a really serious issue, and Dr. Amber Price is the vice president of the Women's Hospital at Henrico Doctors Hospital. Thanks so much for being with us. This is a fascinating topic that really people aren't talking about. So let's dive right in. What is the 4th trimester and why is this happening?
Well, it's a great question. Pregnancy is broken up into 3 trimesters, and most people know that. First trimester is that early part of your pregnancy. Second trimester is where people start to feel really great. And the third trimester is that time where most women have their baby. Pregnancy lasts up to 40 weeks usually, can go up to 42. But the 4th trimester is really the definition of that 3 months after you have a baby. And usually we don't think much about it. Your baby's born, women feel pretty good, they go home, and they don't touch base with their provider for at least 6 weeks. But we know that that time period is actually a crucial time period for women's health.
And so we're seeing that the African American mortality rate is higher, but we don't really know why. It's not necessarily a socioeconomic thing.
Yes, it's the same for women regardless of where they live. We know it's much higher for African American women. Part of the issue is that we lose 40% of women to follow up after they have a baby. They never come back for a postpartum visit whatsoever.
Oh, wow.
So we need to make sure women have access to care, that they have good relationships, and that when they do call, we listen to them and we pay attention to what their concerns are.
What are the symptoms that new mommies should be watching for?
I think people think that it's okay to be very tearful after you have a baby and exhausted, and some of that is normal. But severe panic attacks, being able to not care for yourself or your baby, those are the kinds of things that are not normal. One of the things that we do see sometimes after someone has a baby is depression so severe that women feel like they could harm themselves or others, their baby in particular.
And there are new treatment recommendations that have just come out on this.
There are new treatment recommendations, and some of the things we're concerned about are things like high blood pressure and blood clots and swelling, infection, particularly after cesarean section or a laceration that was really significant. And the American College of Obstetricians and Gynecologists has recommended that we really treat that postpartum period as a continuous time and really start touching base around 3 weeks postpartum or sooner if the woman feels something isn't going well, and not to delay that visit.
Okay, definitely great information. Thanks so much for being with us,
very
Dr.
welcome.
Price.